We're doing eye infections today. Um, so, reading from the Reader's Digest book of health and supplements, multivitamins and supplements. Automatically reaching for over the counter eye drops. When your eyes become watery, itchy, red, or inflamed, can actually make matters worse. Instead, give one of nature's gentle remedies a try. It may prove to be much more effective. Eye infections are usually related to conjunctivitis, an inflammation of the sensitive mucous membranes that line the eyelids. Other causes of redness and irritation are a persistent scaliness on the eyelid edges, called blepharitis, and inflamed, painful bumps at the base of the eyelashes, known as styes. A doctor should evaluate eyes that are red and painful to determine the proper course of treatment and rule out more serious ailments such as glaucoma. Symptoms include pinkness or redness in the whites of the eyes, thick, oozing greenish yellow or white discharge from the eye, excessive watering, dried crusts on the eyelid and eyelashes that form during sleep, sensation of sand or grit in the eye when blinking, swollen or flaking eyelids, a small painful red bump at the base of an eyelash, sty. It's called sty. If the eye is red or swollen with a thick discharge, you may need antibiotics for a bacterial infection. If you wear contact lenses, remove them. If the eye is painful or sensitive to sunlight, or you have blurring or loss of vision, if the pupils are different sizes or an object is lodged in the eye, or if mild symptoms do not begin to wane after 4 days of self care, then do see your doctor. Viruses and bacteria cause eye infections. Inflammation and redness may also occur as a result of injuries to the eye, allergies, or irritants such as smoke or makeup or chlorine in the swimming pool. Any serious eye infection or injury requires immediate medical care. Mild eye infections can be treated at home with natural remedies, but see your doctor if the symptoms don't begin to clear up within 3 or 4 days. First, use a herbal eye wash several times a day. It's called eye bright, as its name suggests, may reduce redness, swelling, or irritation from conjunctivitis, blepharitis, or styes or eye injuries. Eye washes made from the herbs chamomile or golden seal offer similar relief and are good alternatives to eye bright. Finally, filter all eye washes through a sterile gauze pad or clean piece of cheesecloth to promote healthy eyes. Try taking vitamin C as well as the mineral zinc for a month. Both these nutrients enhance immunity, helping to clear away any infection and prevent reoccurrences. Vitamin C may speed up healing and protect the eye from further inflammation. And zinc, which is found in one of its highest concentrations in the eye, may boost its effectiveness. Bloodshot eyes are often caused by leaking or diluted blood vessels in the eyeball. Bilberry extract taken internally may be helpful in preventing this by strengthening the capillaries of the eyes. Drinking eye bright tea will help to reduce inflammation of the eyes, as will the application of a chamomile tea bag cooled after being infused. What else you can do? You can wash your hands often with an antiseptic soap and do not touch or rub your eyes. Change pillowcases and towels frequently. Do not share them with others. Most eye infections are highly contagious. Avoid wearing eye makeup or contact lenses during an eye infection. Wipe the discharge from the infected eye with a tissue and dispose of it immediately to prevent the infection from spreading. For styes, apply a warm, moist compress for 10 minutes, 3 or 4 times a day until the stye comes to a head and drains. For blepharitis, try a warm, moist compress. Apply for 15 minutes to loosen the infected scaliness on the eyelids. Then scrub the eyelid gently with water and baking soda or with diluted baby shampoo. Use a separate compress or eye bath for each eye to prevent any infection from spreading. A French study found that when zinc was combined with antihistamine, 78% of the patients with symptoms of conjunctivitis from seasonal allergies showed considerable improvement. Non-prescription eye drops meant to relieve red tired eyes have been shown to cause some forms of conjunctivitis. According to a recent report in the archives of ophthalmology, overuse of eye drops to reduce redness by narrowing blood vessels may be especially problematic for some people. Make sure herbal teas are sterile when you use them as eye washes, or you could cause further infection. To avoid contamination, strain the cool teas through a sterile gauze pad or cheesecloth and store them in sealed containers. Prepare a fresh batch of teas every day. In addition to their use as eye washes, herbal teas made from eyebright, chamomile, or fennel are good to drink and will help to relieve your symptoms. Have 2 or 3 cups a day. So we're going on to the supplement recommendations, and the supplement recommendation is eyebright, which is a herb. Dosage 1 teaspoon dried herb per 500 milliliters of hot water. Cool and strain. Store in a sealed container. Prepare fresh daily. Use an eye bath to wash affected eye 3 times a day. Vitamin C 500 milligrams twice a day. Reduce dose if diarrhea develops. Zinc 30 milligrams a day for 1 month. Supplements with 30 milligrams of zinc maximum should be accompanied by 2 milligrams of copper. Chamomile 2 or 3 teaspoons dried herb per 250 milliliters hot water. Cool and strain. Chamomile should be stored in a sealed container. Prepare fresh daily. Use an eye bath to wash affected eye 3 times a day. Golden seal. Golden seal 1 teaspoon dried powdered herb per 500 milliliters of hot water. Cool and strain. Store in a sealed container. Prepare fresh daily. Use an eye bath to wash affected eye 3 times daily. I do know that from my brief look into the Ayurvedic system of India, they actually have a certain system where they actually put they have very specific therapies, and they use certain warm oils, and they put certain things around. I remember seeing something in India. Not well, I haven't been to India, but I mean they had something around the eye like a chickpea powder flour thing around, and then they poured the warm oil into the eye, which I thought was quite interesting. But I don't know really much about it, to be honest. So it'd be something that I'd have to look into. But I hope this was helpful, guys, and I will hope to be doing much more. There's a lot of different health conditions in this book, and as I said, I do hope that you found that helpful. And if you do need me to, I could always put some notes down in the description box below for you to read further if you wasn't able to understand what I said. But yes, I will try, and if I do look into the Ayurvedic system, I may post it as well, so you'll be able to see what the Indians are doing for their eye treatment, because it would be quite interesting to see. Okay, thank you, guys.